On this episode of the ASC Podcast with John Goehle, we discuss the latest news, including an update on inflation and worker retention, and meet with the staff of Ambulatory Healthcare Strategies to discuss the latest regulatory and industry trends.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers. Trivalence. Trivalence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. And Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 170 of the ASC Podcast with John Goehle for October 18th, 2022, recording from our studio in Spencerport, New York. This is Sue Cronkite, Chief Researcher for the ASC Podcast with John Goehle and Senior Nurse Consultant for Ambulatory Healthcare Strategies. The ASC regulatory environment is extremely dynamic, and the material provided in this episode is based on information available as of the date of the recording. Joining me is John Goehle, the owner of Ambulatory Healthcare Strategies. He is recognized as one of the nation's leading experts in the ambulatory surgery industry. Mr. Goehle is the author of over 10 books on the ASC industry, and he is a frequent industry speaker on regulatory accreditation and finance issues. So I want to say Happy International Infection Prevention Week this week to everybody. And just a little background, it was established in 1986 by Ronald Reagan, and it's been spearheaded by APIC. So if you want any information, resources, webinars, merchandise, that kind of thing, if you go to infectionpreventionandyou.org or just look up International Infection Prevention Week, and you can find some good information.
I think it's always a good thing to, kind of recognize these events or these special weeks in our surgery center, just so that we can focus periodically on the various issues that we have to do, as well as, Nurses Week and Sterile Processing Week, I think, was last week.
Yep.
It's always a great thing to recognize these events. Sue, we have new microphones. I know I'm excited about it, but you...
I just talked. This thing's in front of me. I don't know.
We're hoping that...
Yes, we're having to upgrade a little bit, and I was trying to improve the sound.
Microphones have been a bit of a problem just because they seem to... The ones that we use here are a little bit more for being on the road as opposed to being in the studio. So we purchased these brand new mics. They are a little bit easier to control. We'll see if we get any comments about how good the sound quality is. And at the same time... we are getting ready for next week, which is the next Director of Nursing Boot Camp. This will be the 4th Director of Nursing Boot Camp that we have done and the 8th boot camp overall. So we're very excited about these boot camps. They're always a great event. It's going to be well attended, and we're going to keep this up. I think we're already planning on in January having a administrators boot camp. So, and in preparation for that, Sue, I've decided to replace our board yet again. I know you're very excited about that since you really hate all those switches. There's a lot less switches in the new board, but it'll help us have a little bit more control over the board that we're using here. Is actually it's relatively new. It's only about a year old, but it's based upon technology from the 80s, whereas the new technology we have out there will give us a lot of capability for communicating through our Zoom link, which we use for the podcast and for the boot camp. So we're throwing the money that we're getting from all of our wonderful patrons out there right back into the business so that we can improve the quality of the products that we offer to you. So, and we do always want to be grateful to all of our supporters out there. Sue, one of the things that came up recently is we were talking about some of the services that we offered Ambulatory Healthcare Strategies, and risk assessments I was talking to a prospective client, and we were talking about, of all things, risk assessments.
Yeah, they're often forgotten, and there's quite a few different ones that need to be done.
And surveyors are really definitely looking for them now. So I do encourage everybody to keep an eye out for the different types of risk assessments that are out there. Maybe we'll do a special episode on that, but make sure that they're up to date. The most common ones, of course, are the infection control risk assessment, the NFPA 99 risk assessment, and the hazard vulnerability analysis assessment.
And then be sure you're using the information you get from that risk assessment to base your policies and your, quality improvement and emergency programs on.
Yeah, and that really brings up a good point that I find when I go out and do a survey is that people do a great job of filling these forms out, but they don't do anything with the information on them. Yeah. Like the HVA is supposed to be used, hazard vulnerability analysis is used to set your policies for the next year, to set your drills for the next year. Same thing with infection control. Infection control worksheet will dictate what your educational programs are going to be for the next year, as well as the surveillance activities that you're going to do. So definitely something you need to keep a close eye on.
Yep, and updating every year. I mean, 4 years ago, how many places had pandemic as a really high risk for their center? And, that all changed. It's not always that dramatic, but it can just change with your, with your patient population or almost anything. So you got to always update those.
So let's move on to our recent news. Sue, what have we got going on with monkeypox?
We had to do a quick blurb about this. So the first case of an infected healthcare worker in the U.S. Happened this week. The first case where they were infected at their job, where it was from a contaminated needle. The person was recapping a needle after they had aspirated some fluid from a sore from a patient that was suspected of having monkeypox, and turned out they did, and the healthcare worker did acquire that. So obviously people should not be recapping needles. And it surprises me in a situation like that you wouldn't be on such high alert that you would just be careful. But
and again, these are standard precautions that you should always be taking. It doesn't matter whether you got a risk or anything. So you're right. It's just
because you never know what there might be. And so it just made me want to look into it a little bit. The CDC said we have over 27,000 confirmed cases in the U.S., which I think I was really surprised, I guess. Yeah. I mean, it's still not that many, but California and New York have the highest number of cases, but the highest rates by population are in Washington, D.C. is the top, New York, and then Georgia. And D.C. is the highest, but it's still 0.016% of the population, so it's still very low. Generally, the disease lasts 2 to 4 weeks, and it has a fatality rate of 3 to 6%. There are limited availability of vaccines, so I think they're trying to get more out there, but again, not really advised for the general public at this point.
So, Sue, we actually have good news about inflation. I don't think it's really that great news, but we do have good news about inflation.
Yep, there was some interesting information I found from the Mercer firm. For the first time in more than 3 decades, inflation has risen faster than healthcare costs. So not great news about inflation, good news about healthcare costs. Yeah. U.S. employers' health benefit cost per employee is projected to be 4.4% for 2022, while the overall inflation is running about 9%. The cost increase in 2021 was about 6.3%, and the expected increase for 2023 is 5.6%. This could be higher, though, due in part to people, maybe putting in claims for long COVID and a higher utilization for healthcare services as people are trying to catch up on their screening and other care that they may have postponed. And as I was looking into that, Mercer also noted some other trends. So 84% of large employers prioritized enhancing benefits to improve attraction and retention over the category of monitoring and managing high-cost claimants. And that second category usually tops the list. So people are starting to look more at keeping their employees happy. Yeah. 74% said they'll be prioritizing access to behavioral health care over the next few years, including EAP services and virtual behavioral health options. The majority of respondents did not plan to increase their employees' contribution through higher copays or deductibles. So again, it's kind of all about keeping employees happy right now.
Right, and trying not to shift too much more of the healthcare cost to the employees.
Yep.
And along those lines, looking at the workforce, what's happening there?
There was a study that was conducted by Bain and Company that found a quarter of clinicians in the U.S. are considering changing careers. 89% of them cited burnout as a reason that they may leave healthcare. 41% said it was for personal health and safety, and 25% said for family or friends' health and safety. So if you put those two together, that's almost as large a percentage as the burnout. So those are the two main categories that are really bothering people. Some reasons that were cited for the clinician burnout are not having the resources to perform their full potential and inadequately staffed workplace. So, this is not really news, but it's, and it just gets worse and worse as people leave. So then I saw the Net Promoter Score, which is a measure of a clinician's likelihood to recommend their employer. It's kind of a scale that they measure how happy they are with their employer. It was 36 points in 2020, and currently it's 19 points. Even worse, the clinicians at management-led practices such as hospitals and health systems only gave a score of 6 points, while those at physician-led practices had 40 points. So they're a lot happier, and so maybe that's good news, for ASCs. And another note, the staff RN turnover rate has exceeded the overall hospital staff turnover rate for the first time, although it was just barely, with the RN rate was 27% versus the overall staff was 26%. The top 5 areas of importance to the employees were compensation, the ability to provide patient care, workload, flexibility, and they wanted more clinically focused job responsibilities.
In other words, not doing a lot of the cleanup and things like that.
Yeah. And I think, we've talked about this before. If you don't feel like you're able, people go into healthcare to help people.
Right.
So if you feel like you're rushing and you're not really getting that rewarding feeling of helping people, if you feel like you're leaving your job every day not feeling like you've done your best, that's just draining. So that doesn't surprise me.
And we see this a lot too, especially as we try to recruit nurses into leadership positions that they often perceive, and perhaps it is true, that there's a lot more paperwork involved in that.
Yeah.
And I think that certainly is not usually going to give a very good job satisfaction to an individual who really wants to take care of patients, even at a leadership level. Which is why companies like Ambulatory Healthcare Strategies exist. We're trying to take that pressure off of the clinicians, and that really just gets down to the point too, is that as we have fewer and fewer clinicians out there, this workforce gets tighter. Finding alternative ways of pushing some of that administrative functions onto other individuals is going to be even more important.
Yeah, and they actually did have some good ideas. I just felt like this was getting kind of long, so I didn't put a lot of that in here. But if you look up, it's a treatment for America's healthcare worker burnout by Bain and Company.
And we'll put a link
And they had quite a bit in there, like what you said, more administrative staff doing more of that stuff, freeing up the clinicians, and just ways of helping people to feel like a little more rewarded with their job. And then kind of in the same vein, Becker's hospital report, I know it's hospitals, but I'm sure it's pretty much across the board, from October 13th, also mentioned the 27% turnover rate for hospital RNs, and it gave a little bit of data on the cost of this turnover. So the average cost of a staff RN turnover is $46,000, involving all the training and all that kind of thing to get somebody and finding new people, all of that.
And it's going to be higher in a hospital than it would in a surgery center,
definitely.
But it's still a pretty significant number.
Yeah. Each percent change in turnover can save or cost a hospital over $426,000 a year. And if a hospital can eliminate 20 travel RNs, they can save over $4 million. So,
wow.
Very incentivized to do that, I'm sure. And then this is something that Lori had brought up that she'd heard of. I found it in the British Journal of Ophthalmology when I went to look for it. Cases of post-vitrectomy endophthalmitis have increased since the COVID, they phrase it, the COVID mask wearing period of time. So as long as people have been wearing masks. The study noted the increase was significant, but I'm not a mathematician, but the increase was from 0.11% to 0.21%. So it didn't seem huge, but it's something,
well, it's still doubling
to be
of the
aware
rate.
of. Yeah, it's just a low rate, but it is a doubling of it. However, in the mask-wearing period, some cases of oral bacteria were noted in the eye cultures, and those had not been noted before. So they're saying, because you're breathing in that air from breathing from your mouth is going up by your eyes, that a different type of bacteria is getting in there. So it's something to really be aware of and making sure you're ready to treat that.
Well, and I think it's also the design of these masks too. Might be something we're going to have to look into.
If you had an N95, then it probably wouldn't be happening. But they're talking, the patients are just coming in with the regular masks.
Especially if they have cloth masks or other things.
Now, it wasn't noted in cataract surgery, which is interesting. It's just supposed to vitrectomy where they notice the increase.
And let's just talk about some recent experiences. Some of these come from our own experiences in the industry, as well as some situations that are brought up to us in our Saturday drop-in sessions for our patron members. And one of our members noted, and another person said the same thing, that they had received a notice from NHSN that they had not submitted their data from 2020 for the COVID-19 vaccine.
But of course, looked and it was in there. I mean, so they had. So it was just
we're not quite sure what had happened there because in both of these cases, the data had been submitted. So if you get this notice and you know that you submitted the data also, recognize that you're not alone and just contact NHSN to double check to make sure that data is there.
Yeah, and we'll let you know if we hear something on this Saturdays that it was resolved or if they got, another notice saying that it was a mistake.
Right.
We'll follow it.
So, Sue, during the New York State Association meeting in Tarrytown in September, we had 12 of our employees all together at one time, which is very rare to have them all in the same spot. So, of course, as is our way, we took them, shoved them into the little mini studio that we had created at the conference and sat them down to talk. Isn't it always funny how they all sit down and they're kind of like, we really don't have anything to say. I'm shy.
Yeah, and then they lose control. I had to edit that, and there was a whole lot of laughing in some areas that just had to be cut out.
It was a lot of fun though. But we always find it interesting to get together and talk about things and just getting a little bit of I don't know. I hope our listeners enjoyed as much as we enjoyed recording it. But there's just so many things that are going on in the industry, and when you have 12 people in the same room, there's just a lot of brainstorming going on. So, and even some of our newer employees were there and able to join in. So, we're going to take a short break, and we'll come back and have that interview that was recorded during the September fall conference for the New York State Association of Ambulatory Surgery Centers. It's been a long day, and the surveyor's just left, and you are exhausted. And looking at the list of items that you have to address, you wonder, how can I deal with this and still take care of my patients? More importantly, you wonder, how can I ever keep up with all of the regulations, standards, and accreditation requirements? How can I always be prepared for a survey and reduce my stress levels? Well, that's what Ambulatory Healthcare Strategies does, day in, day out. We become your outsourced regulatory and accreditation resource. We can maintain your policy manual, develop your education programs, help out with fire and disaster drills, do your risk assessments, oversee your quality improvement activities, help run your quality improvement meetings and governing body meetings, and we can even prepare your monthly or quarterly financial statements and help you figure out where you are financially. We are a retainer-based service. We don't take ownership. We don't charge based on your revenue. We have one fixed monthly fee, and we can tailor your services to your exact needs. So whether you're looking for help getting over a survey, preparing for a survey, or looking for a long-term relationship to assist you with your ongoing regulatory and/or financial needs, please give us a call at 585-594-1167 or email us at info@ahstrategies.com. That is info@ah-strategies.com, or visit our website at ah-strategies.com. So, we are all together again, as we were last all together at the ASCA 2022 conference. We're here at the New York State Association annual conference in Tarrytown, New York. It is September of 2022, and I have with me my wonderful staff. We have a huge presence at this conference. 12 employees are here at the conference, representing approximately 10% of the attendees, by the way. And we also have a client member, Ellen. We're not going to use her last name for reasons that might be apparent a little bit later on, right, Ellen? But welcome also, Ellen, and one of our loyal listeners here. So, as we often do when we get together for these conferences is just kind of go around and talk a little bit about, some of the things that are going on. And we're going to do things a little bit differently. I'm just going to kind of point to people and just randomly ask them questions. So just to kind of, don't worry, I'll be pointing. Actually, Donna, I am going to start with you, and I'm sorry to do this. So Donna Macchio joined us about 4 or 5 weeks ago. She was with one of our clients. She is a senior nurse consultant. She has been shadowing me for a couple weeks. She is picking up on things very quickly and learning the ropes, which is not a big problem since she's been doing this for a while.
21 years.
Okay, see, she said I cannot say these things.
She had to say it.
Since I was 12.
There you go. That's right. That's right. And we won't, not that she has grandchildren, we won't talk about how that happened either. But so Donna, it's interesting. What has been the toughest transition from being a client to actually working for multiple clients here?
The toughest transition for me is that running my own center, making my own decisions every day. I just would be presented with an issue, make the decision, and then I just owned it, right? So if I made the wrong decision or if I had to revise the decision, I could just do that and work through that with my own center. Being involved with other clients on behalf of this company is a little more difficult because I want to make sure I don't want to give the wrong information. I don't want to make the wrong decision and have to go back and say, oh, by the way, what I said was this, but what we really should be saying is this. But honestly, for me, the best thing is that everybody here has been so helpful. I can just say, hey, this is what I think. Am I on the right page? And I get an answer like immediately. Yeah. So it's good. The last thing I want to do is give somebody who's reaching out for help. I don't want to steer them in the wrong direction.
Right.
Because that's not what we're here for. We want to.
Well, and for those that are not aware of this, because of the resources available and the technology that we have available in our company, I'm actually going to look at Alex for a second here. Alex is the Director of Operations, but we have the technology to be able to, if somebody has a question, to type it into our system. We're using a pretty standard program, but it is encrypted. That allows us to ask a question and then get an answer pretty quickly. Alex, talk about the technology, and since you help to administer that system, how important you think it is as Director of Operations to keeping this operation running smoothly.
Yeah, I think it's pretty critical, and we tried a few programs before this one, and they didn't seem to work well. And one of the reasons for that was accessibility. Just all of the other programs, they either wouldn't alert you like you want them to, or they just
didn't work on all the platforms that
we're using, or you have to go jump through hoops to even get to them. So this one's been phenomenal, and I think an underrated part of it too is the morale boost.
Yes,
the ability to kind of play with it, have fun. We have a few different secret chat rooms for the different levels.
Just
They're
discovered
not so secret.
I just discovered the granddaughter channel where pictures of grandchildren show up. So
that's my favorite one.
Yeah, I think so. Yeah, but you're right, and I think that's a morale booster, and it keeps things off of our text messages, which we already know. The nice thing about this type of a system is it's accessible to anybody, and just email me. I don't want to mention it to everybody here, but if you want to have some more information about how we do that with that technology, what's nice is, as Alex said, there's multiple channels, which means like there's a channel for our surveyors on our team, that we can talk privately. There's a life safety one, there's a finance one, there's the all one, which seems to be where most of the occurrences occur.
And there's the super secret awesome.
And then there's the super secret.
The all one, we get a question, and for an hour, I'll hear the ding, 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 ding.
Yeah.
But
Because,
it's a different
lots of answers,
sound.
though.
It's a
Yeah.
different sound than your email, and it's a different sound than your text message. So when I get that sound, I know it's
You
my
know
boss
that
needs something, usually. So then you go to answer it, and it's a picture of a grandchild, and you go, well, thank you so much. Thanks for sharing that.
I guess I need to learn that section because I haven't figured out what.
Or a dog, there's a lot of
puppy
that.
section.
Yeah,
But if
puppy
you
section.
have a question, if you're on site,
Lots of responses.
if you're on site with a client, you get to feel that you're not there by yourself.
Yeah.
Because within literally seconds, you will get an answer. Because I have absolutely no life safety. I'm always reaching out. Does anybody know this? Or I haven't seen before because I have probably the least amount of clinical experience. You guys are right there. So it really gives you that feeling of not being on site by yourself.
Right. We're part of a family.
It's a family.
Yeah.
So when you were on your survey recently, I was at home working, and your question popped up, and I read it, and it was boom, 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 and I thought, oh, I love this camaraderie, this teamwork. You're not alone. And later in the evening, when I was having dinner, I said to my husband, "This is great because within seconds you had answers, and within I don't know, maybe 20 minutes, you had a policy." I thought, I love this. This is great. It was really awesome. Very impressive. Very impressive.
I agree with that too. Anything.
So this is Mary O'Day. We probably should introduce ourselves before we talk. Mary is one of our consultants here, works on some of our data and data entry.
But I get Stu's been everybody has been very good about getting back to me whenever I have a question or a need, and making sure that things are followed up. Everybody works together very well.
Yeah, and asking for work, because often Mary, if she's got some free time, she'll just type in there, "Hey, you got any work for me?" And so it's just a really great way of communicating, and everybody wants to, pull their
all hands on deck all the time.
I do want to lean into this issue actually of this recent survey, because the poor victim of this survey is here with us. So the background of this is that I was intending to show up on Monday and Tuesday for a scheduled accreditation survey, and then on Wednesday of the week before that survey, we get a phone call from one of our clients who said, "You're not going to believe this. 6 people just showed up from the Department of Health." 6 people showed up.
Repeat.
That's right. Repeat that again. From the Department of Health for a survey. Ellen, you were the victim. I don't know if you're close enough to a mic to be able to talk. But and thank you so much for joining us. I know this is a lot to ask of a client to step in, but talk about how you had been prepared for a HHHC survey, and then they suddenly showed up. How did your staff react? Was everything ideal? Or was it almost like a panic?
Not everything was ideal immediately.
Yeah. I mean, you were ready for a survey. So you had it.
Donna and I were ready for survey.
Yeah.
Our staff ever really ready? They push you to the limit there.
Yeah.
We'll do it on Monday and Tuesday when the survey is here.
Yeah.
So when the message rippled through that DOH is here, that this is not a drill.
That went out. DOH is here. This is not a drill.
They did. So DOH brought me in the room. They told me why they were there, and they said, "Take 5 minutes to call whoever you need to."
Yeah.
And you and Judy were the first people I called.
And of course, I was in California, so I was a little bit of a way away.
And it takes me a minute to get to get on a plane and get to Long Island and get to you just as they were leaving.
To the point that you were saying was that you were on a plane in a minute. You got to me a few hours later, but when you got there, I didn't just have you. I had the whole team.
Yeah.
And I knew that. I had, 6 people, 12 people, answering the questions and helping you through this. And as brutal as it was, having 6 people there for 3 full days, it was because the team was there. And
I'm glad you feel that.
It really, helped.
Here's your dollar.
So.
You get 12 of them today.
Well, and I think what I was also trying to get at is when it happens, nothing else should matter.
No.
I mean, it's not like you lament the fact that some things were not perfect.
Correct.
You gather your wits. There's nothing you can do.
Go with what it was.
Whatever flow is, and recognize and as we said to you well before any of this occurred, is that you've been around for a long time. You have excellent outcomes. You have an
Center.
That was started out as a compliment.
Yeah, sorry. This is where, as Sue says, I stuck my foot in my mouth again. Yeah.
Talk with that dollar, you might be writing your checks.
There it goes back. But truth.
In my wheelchair.
Oh, she's good at that. And I have her over more often.
I can see us cutting an awful lot out of this interview. But the point being is that, of course, you lean into it, you go through it, and that the likelihood of even a survey like that actually shutting you down or you failing the survey is small. And whatever, as we told you at the time, is that we walked through, we know your center well. We never found anything that was so bad that it would be That's right. Lori's got the loser thing on. No, that's not what we had. And of course, so that's what you have to remember as you're going through it, is that surveyors are there to find a problem. 6 surveyors, and there's no way 6 surveyors are going to go back to the office and say, there was really nothing I could find the entire time. They're going to lose their jobs.
But they almost did.
Yeah, that's right.
They almost did. They really didn't find
They found things at the last minute.
Yeah.
Kudos to you.
Yeah.
That's right.
Yeah, kudos to you.
Absolutely.
And I don't think it was just because we were preparing for AAA.
Yeah.
I believe in my center,
Yeah.
and I believe that we run a good center, and I
Right.
believe that we practice well. Do we do everything perfect all the time? No.
Yeah.
But for the most part, just from, as you say, the outcomes.
Yeah.
We have a super low infection rate. We have high patient satisfaction. We provide quality care.
Yeah.
And you can't fake that on the day of AAA.
Right.
It has to be natural, and it has to be how you practice all the time.
So I think one thing that I try to say to our clients, and that we say to our employees all the time, is that the challenge with the regulatory environment, accreditation environment, is that there's going to be situations where there's not going to have a straight answer, or you're going to have 2 regulations that conflict with each other. And what I've always said is that you do what is right. Now, Ellen, you are a nurse, by background. That comes natural to you. It comes natural to us here. But if there's one lesson that needs to get out, is that when in doubt, do what's right. Mm-hmm. And then worry about the consequences later.
Correct.
Yeah.
Right.
And that comes down to, this hasn't happened, but imagine a scenario where we talk about never grant people emergency privileges. There's no such thing. You should not be doing emergency procedures in a surgery center and granting somebody this. If somebody ends up in a difficult situation in the middle of a surgery, and you happen to have another doctor in the same building 2 minutes away, and he can come over and help, but he doesn't have privileges, you bring the doctor over to help, and you just do the right thing, and you worry about the fact that he doesn't have credentials later.
Right.
And if
the right thing is always what's best for the patient.
That's right, because
Not
then you
what's
can
best
always
for the
justify
center.
it.
It's what's best for the
Isn't
patient.
there a
Yeah,
saying
yeah.
about better to ask for forgiveness?
Yeah, that's exactly right.
Then
Yeah.
ask permission.
Yeah.
Correct.
Yes, I lived by that for a long time.
Yeah. Jim, I'm going to pick on you next, since you just walked in the room, and I just love picking on people at the last minute. Jim Masters, he's our life safety, one of our life safety experts. We have quite a number of them on our staff, and I'm sorry, I was promised not to say experts, didn't I? Jim is a surveyor with one of the major accreditation organizations. Jim, you and I and our friend Anton Mitchell just did a session on what are the common things going on in the life safety field right now. It was interesting talking to Anton. It's always great to have him in person. Talk a little bit about your observations from that, because we walked into it not knowing what the questions were going to be. What did you find interesting?
Well, I think that John, the president of the organization, had some good ideas of what we should talk about, and he just kind of threw us, a little tidbit of information. Hey, we had talked about the HVAC system, and we just kind of took the ball and ran and talked about all the various components of the system and how it affects not only infection control, but the center itself. And we talked about if the building owner owns the HVAC system and the center is just part of that their challenges to get the owner of the building to support them.
Right.
And then we went into the EES systems and the components and the differences between the type of sedation you use and the type of EES that you have to have. So it was actually quite interesting, and the time flew.
It did, yeah.
And we really didn't need any guidance.
Right.
We all shared our little bit of expertise in that area, and it came out. I guess it came out well.
It did, yeah.
It was a great session,
Yeah.
and there were people standing in the back.
Yep.
Yeah.
Well, and the comment that needs to be made, and what I made on the podium too, is, which we always have to remember, just because you've been in existence for 20 years and have never had something cited doesn't mean it's not going to be cited now. We've seen that. It was brought up during the conference, during the sessions there. And I guess I do mean to scare people, because it's important that people be on top of this and be prepared for that type of a problem.
And again, the caliber of surveyors
Yes.
and the level of their education and expertise is increasing.
Yeah.
It's no longer the firemen who, worked in the fire department for 30 years. You've got people who are life safety specialists for their entire career, now deciding, I think I'm going to survey, and they've applied and been accepted.
Yeah.
And we've got hospital engineers that have 35, 40 years of experience. So the caliber of training and education for the surveyors is that much higher. The bar has been raised.
Absolutely.
And I think the
And
challenge.
by the way, this is Michael D'Ambrosio. He's also on our life safety team, and in addition, a couple other teams. But go ahead, Mike.
What I think the challenge is the centers getting up to speed on those things. What I find is there just isn't a lot of knowledge out there, and it's important that the administrators get up to speed or get the help they need, because I see that as being a real opportunity.
I think centers have to really dig deep and come up with a way to hire someone who's going to be in that capacity of their life safety specialist at the center itself. And set up a network so that on-site person has us for a resource to help them train and get their people up to staff, because there's very few places, unless they're affiliated with a healthcare network, that have the ability to have that one person who's responsible to do all of these things.
I think it falls through the cracks because people think.
Sue Cronkite, by the way,
Yes.
co-host. Go ahead, sorry.
I think, you think you need nurses, you need the doctors, HR, credentialing, all of those obvious things. But the building, I think sometimes you feel like it'll just take care of itself, or, if there's not obvious things like there's a huge hole in the wall or something. But they don't realize how really specialized it is.
They need to invest. They have to make that investment in the idea that I need somebody
They
to do this.
take it for granted as well, especially if they're lessees and they're leasing space from a building management company or an owner-operator, that, we pay them, they do everything we need. They might do it, but it's not at the level that CMS requires.
Right. And it's critical that you have that internal support for support for the administrator, and then also the external support, because again, one person won't be able to know it all. I don't know it all in terms of life safety.
So I'm fortunate enough at my center to actually have somebody that is, he's not fully credentialed in life safety, but he has studied it and is learning it and on that pathway. And he does work at the center on a daily basis. So he is a little bit more on top of, the everyday stuff, and he's learning more in depth, but he has his resources as well. So if I have a question, I do have somebody on site as an immediate resource. And when I do have my surveys, he is available to come in. And be with the life safety people and walk them through, take them up in the ceilings and do that, because he's up in my ceilings all the time. So he knows what's up there. He knows what he's
crawling around.
I don't think you're the majority. So I don't think everybody is. Like Donna, Donna and I had a conversation today about how we have a center that we work on together that says they have this life safety guy, but he doesn't come in. He's not there. Like ever. They go, well, that's
I think the challenge sometimes is, and for me at my center, it was a challenge, especially early on, is to convince the owners how important it is. If you're a center that's been around for a while, 10 or 15 years ago, you could get away with the administrator climbing a ladder, popping out the tile, and looking for perforations in the smoke compartment, right?
Yeah.
Well, you said it, the education level of the surveyors is way up, and it just doesn't cut it anymore. And I think you have to really get the owners to understand that it's really important to have somebody who is an expert in the field, because the administrator who's doing all of the other things that he or she needs to do is not going to be able to check all of those boxes. It's just not possible.
They're not going to have the knowledge.
They're not going to have the knowledge or the time.
And this is a real problem. This is real. This isn't,
But it is convincing the powers that be, or whomever they are.
But that's the primary reason places get closed.
Lori Rodricks, by the way, our infection.
You're right.
It's usually a life
safety issue.
Yeah.
It's very
And it's very
saying
expensive to
life safety concern. So they will close you for that
Right.
way before your credentialing issues.
Yeah, your credentialing files or your clinical people. Yeah.
Well, since Lori started talking, Lori is our Director of Clinical Operations for Ambulatory Healthcare Strategies and our infection control expert. That's right. So now that you brought it up, what are the things that are most urgent right now? Life safety is definitely one of those things that can shut them down. What is another one?
Jim, what is another one?
Well,
I'm sorry, go ahead, Jim.
Continue with the life safety thing.
Sure.
Is that I was at a accreditation gathering of the governance unit, and they actually identified that for early option surveys and initial surveys, that the number one stopper for not being accredited was a life safety issue.
Yeah.
And that's our experience too.
And they don't tend to be an easy fix either.
Yeah.
Right.
No, you're
And
right.
very expensive.
Easy or inexpensive.
Well, and for those of you listeners out there that are developing new centers and have been working with an architect, and the architect has not referred to CMS regulations at any point. In other words, they've been talking about the local, passing the local building codes and the state, Department of Health codes. That's not enough. You got to be prepared for the CMS survey, which will be tougher than all of those other ones. To Jim's point, very good. Okay, back to you, Lori. What is another reason that a surgery center might get into a deep trouble?
A lot of infection control type situations.
Especially post-COVID.
Yeah, especially with COVID and monkeypox and measles, mumps,
Ebola.
Yeah. Ebola.
Polio.
But that's a big deal, as well as instrumentation.
Yeah. Actually, good point.
That's a really big. People don't ever necessarily understand, especially physicians, and I'm not picking on them or governing board members, but they don't appreciate what the staff in the sterile processing or the high-level disinfection areas of the center need to do and keep them safe. So that's a lot of findings, and yes, I am the meanest one in the world.
They're actually the most important people in your center.
Absolutely.
Right? They touch things that touch every single patient who comes through the door.
Yeah.
Donna, that's a nice way to say it. You're right.
They really are.
Yeah,
They should be
they are the
considered the most
heroes that
important.
nobody knows are there.
Absolutely.
Never thought about it that way, but you're so right.
Absolutely, they are.
Yeah.
And people overlook them.
Yeah.
They're back there working. They're not, but truly, they are the most important people in your center, along with your receptionist.
Also true.
She's your first impression.
That's right.
Everybody's important.
Excuse me, you're
I'm
right.
sorry, he or she.
Okay, Jenna Alvarez, who is Senior Nurse Consultant. She's our startup specialist. And Jenna, you've been a little bit busy lately, right? Talk a little bit about some of our experiences with startups and some of the challenges we're running into.
We've had 3 new centers that we've been working on. We have one that's just gotten past their accreditation. We've got one that's waiting to get their accreditation, deemed status survey, and we've got one that's still getting ready for their pre-opening survey in New York State, and we've got one that's just working on getting their CON approval, and then we'll be moving fast on that one. So it's been an exciting time, lots of growth, and
but there's been
never
problems,
never on the timeline that we think it's going to be. Our centers that opened, they just got their accreditation. They thought they were going to open in December. They finally had the pre-opening survey in April. Got their accreditation in by the time we got the approval, it's been September.
Yep.
So it's never usually exact. You always run into a random problem here, a random problem there.
Yeah, and the supply chain has been horrible.
And don't change your name in the middle of it.
Well, at least if you're going to change your name, you file it properly.
I will say that has been an issue on all 3 projects.
Yeah.
Name changing?
Name changing.
I must have been in there.
I know it's really, really hard, but if you can figure out your name right in the beginning and stick with it.
It looks like a Mary.
This is an audio podcast, but Lori was holding a baby. Yeah, it's surprisingly very important.
So one of the challenges that we've had as we have grown has been that technology, of course, the world outside is changing quickly, and we're realizing that we need a different technology solution, which would, do things like gather all of our statistics, gather our incident reporting, gather our nursing chart audits, help, maintain credential files, things like that. We're finding ourselves, we have a good technology, system, but the world is changing around us. So now we are in the process of negotiating some type of partnership, teaming up with an organization that will help provide that technological solution, because we're not going to develop in-house.
Yeah.
And Jenna, to that point, you of course have taken a bit of a lead on this, but I'm going to call on my consultants, because Jenna, is the one that knows what we need, but we always have to rely on our consultants, the people that do the data entry, Mary and Laura here, who actually do that. So start with talking a little bit about, because you spent quite a bit of time talking to some of the providers that we're thinking.
So a couple of my centers have already started moving towards different solutions, and a couple of them have either said, hey, we're interested in something, moving to something like this, or I say, after I say, your incident reports, oh, well, I gave it to Dr. So-and-so to look at, Dr. So-and-so lost it, kind of fine.
Oh, boy.
I was like, okay, maybe.
Yeah.
Maybe it's time to get rid of paper.
Yeah.
That maybe we won't lose things or it was, because it wasn't just the incident report, it was, okay, what about your in-services you did this quarter?
Right.
Well, the binder's missing.
Yeah.
Which, people are busy, and I get it. There's so much going on, and you don't have enough people. And so I'm like, let's make our lives easier.
Yeah.
And it makes my life easier, because instead of sending, hey, can you send me your startups? Hey, can you send me your incident reports? Hey, can you send me your patient satisfaction data? I have access to all of their data right through the the platforms that they're using. And it's been nice. We've been talking to some of the vendors here about, some of them are growing. And I said, well, I've got some ideas.
Yeah. Well, because it's so important, and again, I'm looking at Laura and Mary here who gather all this data, and I'm telling these vendors, okay, Jenna and I can talk until we're blue in the face, and Alex, but to be honest with you, this has got to be user friendly. Right. And it's got to be something that, and again, I'll have both Mary and Laura speak, it's got to be something that you can work with. And of course, you got to train, you're the ones that are going to be working directly with the staff that's going to be entering on the other side. So I know you've had some talks, I haven't talked to you about that. Any observations from that conversation?
Alex Center actually uses
one of the solutions.
One of those.
Yeah.
And for me, because I'm always Ellen, I need.
Yeah.
Now I just go in.
We never even talk anymore.
We don't even talk anymore. I don't even have a conversation with it, but it's so much easier and time saving.
Yeah. No more emails back and
no
forth.
More emails back and forth. Now I can just say, hey Ellen, how you doing?
Yeah. Or you can talk about what was entered rather than information. Right. You can get to, and that's the point that I really want to get to, is that these solutions provide the data. You still got to analyze it. It's not like it solves your problem.
It's not like it's done. I mean, you still have to read it and make, and do something with it. But it's such an easier, and I'm old, and I'm paper. I grew up with paper, and I don't want to get rid of paper. But I so that, once you adjust to it, it's just so much more convenient, and it's a time saver.
Yeah.
And the platform that I use, you could get either the detailed report of every comment I entered during my chart audits, or every comment in the incident reports, or you get a summary report.
Yeah.
And you get a summary of the compliance. So I use it for all my logs. I got all my papers. So I use it for my refrigerator logs, my glucose logs, my temperature and humidity logs, and it will tell you, okay, you really were supposed to complete 30 logs, but you only completed 26 of them. Yeah. And of the 26 you completed, 90% of them were compliant. So it just spits it out at you. And my staff has gotten used to it. My staff now are doing the incident reports instead of coming to me and saying, this is what happened, and I be handwriting out an incident report. They're entering the information, and when they enter it, I get an email so I can open it, read through it, and then I do the quality part of it. So I go in then and review it and decide do we meet standard of care? Were there any trends noted?
Yeah.
Does a peer review need to occur? And complete it that way. So the communication on it and the ease, and the staff gave a little resistance in the beginning, but now like code cards, like they do it, you know, and the platform we use, they used our forms.
Yeah.
So we didn't even use their templates. We sent them all of our forms, so nothing had changed, and so it made an easy transition. My favorite part of it is the doctor peer review. So I don't have to sit with the doctors anymore. I go in and I assign 10 charts to, and then the luxury of his home, his office, wherever he wants to do it, he can do his peer review, and I just assign, and I don't have to see them anymore or sit with them and walk them through. Okay, now click this.
Not that she didn't enjoy their company, because I'm sure she did.
And that's a made-up doctor's name.
So,
That's a made-up doctor.
It's such a time saver in a sense. And for a doctor, for a nurse, and for everybody. It's fantastic.
Do you find it more accurate? With the
I find it more able to read.
More able to read.
I find it more able to read.
Oh yeah, that's what I do.
So watch for that. We'll be making a decision
I'm
very shortly.
excited about that. I'm very excited.
Yeah. No,
I
I think
talking
we're.
to a new one today too that the technology is really
It's amazing.
Yeah.
It's amazing how
the logs today. There's a QR code on the machine. You just put on the refrigerator, and you scan it, and then you can enter it right from your phone. It's
It doesn't get
genius, but simple, but
oh, thank God I'm not in the clinical area anymore.
So we're going to have to describe to.
We will convert you yet, Laura.
So you think.
I did want to finish quickly. One of the things that occurs when an organization grows as rapidly as we have, and we have doubled over the last 18 months, is that we find ourselves, unlike some organizations that are top heavy from the beginning, we're definitely not top heavy. So we are in the process of transitioning. we're transitioning Sue, who is going to be kind of moving a little bit more into administration, taking less of a role directly with clients. So she is. You should see the smile on her face right now until she sees all of the work that's involved in administration. But I do want to thank Sue. You've already been, instrumental in really helping out here. What's been, what are the challenges you see ahead of administrating this group of
Crazy
can't use John's name.
Yeah.
They're a very unruly group here. Trying to corral them all. Just learning all I'm not real technical, so I know some of the things are going to be more computer based and trying to figure out the spreadsheets or things like that. So I think just it'll be a learning curve, but I am excited about it.
Well, and so for those of you that are clients out there, understand we recognize some of the challenges that we've had with our growth, and the fact that you are sent multiple copies of bills over and over again. We apologize about that. We're working on solving that problem now. I'm looking at Ella. She's, but I paid you 7 weeks ago. Yeah, I know. Sorry about that. Well, thank you all. We are late for dinner already here, but I do want to thank all of you for taking the time. So,
you're going to feed us?
Yes, I'm going to feed you now. So.
Oh, thanks.
Thank you very much.
Thank you.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking arrangements for John and his staff, and other events in the ASC industry.
And Sue, I'm going to be heading up to the 2022 Northeast ASC Conference, which is presented by the Massachusetts Association of Ambulatory Surgery Centers. It's going to be on Friday, October 21st, 2022, at the Massachusetts Medical Society Conference Center in Waltham, Massachusetts. Wonderful center. I've been there a number of times. And both Lori and I are going to be there. Lori and I will be speaking. I'll be speaking about accounts receivable. And I don't know what Lori's talking about, but you can pretty much bet it's going to be about infection control.
And the ASC Director of Nursing Boot Camp for nursing leaders in the ambulatory surgery setting is coming up. Like all of our industry-leading boot camps, the Director of Nursing Boot Camp includes reading materials, virtual mentoring consultations, and an intensive 4-day virtual conference that will be presented October 25th to the 28th, 2022.
Which is next week from when we're recording.
Tuesday to Friday, right?
And the Washington Ambulatory Surgery Center Association's 2022 Annual Education Conference and Trade Show will be held November 2nd through 3rd, 2022 in the Tulalip Resort and Spa in Tulalip, Washington. I love saying that, Tulalip. And I will be doing a session there, and we'll also be recording a special episode while we're there.
Okay, so when Rosie eventually has more puppies, do we call one Tulalip?
Could be it. That'd be a cute name, yes.
It would. The Pennsylvania Annual Meeting and Educational Conference is November 7th, 2022 at the Hershey Lodge in Hershey, Pennsylvania.
And moving on to 2023, we can't forget that the ASC Administrators Boot Camp for administrators in ambulatory surgery centers and those looking to become CAS certified is going to be January 24th through 27th, 2023. And just like all of our boot camps, it's presented virtually and includes mentoring too, including weekly drop-in sessions, optional drop-in sessions, as well as books and all kinds of mentoring opportunities.
And the ASCA 2023 Winter Seminar is January 12th through the 14th at Caesars Palace in Las Vegas, Nevada.
And I'll be there presenting, I think, a series of finance classes. And the AORN Global Surgical Conference and Expo 2023 is April 1st through the 4th at the Henry B. Gonzalez Convention Center in beautiful San Antonio, Texas.
And last is ASCA's 2023 Conference and Expo, May 17th through the 20th, 2023 at the Kentucky International Convention Center in Louisville, Kentucky.
And we haven't been to Louisville for a while. I was there for one of the winter seminars or one of the finance seminars. I can't remember exactly which it was, but it was a beautiful location. So we're very much looking forward to that in May. And also, don't forget about our recorded events. They're all available on ASCPodcast.com. We have a credentialing conference, a finance and accounting conference, conditions for coverage conference, medical director conference, and, of course, our self-paced versions of our Director of Nursing and Administrators Boot Camp. So all of these are in-depth conferences that really help prepare surgery center leaders for all facets of their operations. And, Sue, we've had a big increase in the number of patron members within the last couple months, and I think that's because people are really enjoying the various benefits that come from being a patron member. And probably the biggest benefit that people find is that Saturday drop-in session, which Saturday mornings at 10 a.m. we have a private for all the patron members, and we have a lot of fun on those sessions. We got to get a lot of great ideas. The patron program, which is also known as ASC Central, is an exclusive membership website that provides a one-stop ASC regulatory and accreditation compliance, operations, and financial management resource for busy administrators, nurse managers, and business office managers. And these patron members also have access to some of our virtual conferences, pre-recorded virtual conferences, including the credentialing conference and the conditions for coverage conference, various example policies and procedures and forms, example minutes, and discounts and services and books and access to AEU credits. Membership helps defray the cost of producing the podcast, including research, staff, travel costs to conferences, equipment costs, including all this new equipment that we're purchasing, and the various production costs. For more information, you may visit ASCPodcast.com. So that's it for this episode of the ASC Podcast with John Goehle, and please spread the word about our podcast with your friends and colleagues, and do us the honor of hitting that subscribe button. The sound editor for this episode is Susan Cronkite. Executive producer is John Goehle. Research assistance is provided by Susan Cronkite, Jenna Alvarez, Judy D'Ambrosio, Alex Borneman, Zach Kelritis, Amy Durbano, Lori Rodricks, Ann Geyer, and Donna Macchio. Music is provided by Media Sushi and Mike Noah, and the ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast channels.
This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, Trivalence, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. Trivalence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable insights. Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute, legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you are interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.